We'll wait a couple minutes. Not sure everyone's available for today, so we'll just wait and see who joins on. Hello, can you guys hear me?
Yep, I can hear you.
Okay. Did you hear me before?
Yes, I could hear you before.
Oh, okay. Because I thought my mic was off. It had an X. I was like, oh no, I don't
Oh,
think they
okay.
heard me. Hello, everyone who has joined so far. Just waiting to see who all joins for today. On today. The last meeting, it was mentioned that we, you know, have uh, meetings to walk through any questions and, of the system. So today we don't have a set agenda, um, but more so opening up for any questions that you guys have for the system, any workflows. Amanda, did you have any agenda items for today?
No, I don't. Just to bug Jody if if I can, if you saw my email.
Yeah, I did. I sent you a list back a couple weeks ago, which included, that was more of an in-out reply, in terms of who gets paper and who doesn't. So now you just want the list of our doctors that work in-house?
Yep, that's all I need.
I don't have one, but I can get one from the clinical team, from the medical affairs.
Yep, that's all I need. Thank you
Okay.
very much.
Yep, no problem.
So how's navigating through Power Chart with mid 2020 going? Have any questions on Power Chart? Where to view certain things?
I don't really have much to say, honestly. I think navigating through PowerChart from finding information from coding perspective, I think our training here, the coders we did a lot of playing around, just clicking around, seeing what we could find and, that kind of thing. I think the interfaces are still a mess, but
But you're able
Not
to
for this-
find them
not for this
and
team,
everything?
but
And you guys have access to the location history application as well to kind of help with the times. in
Where
the
is that,
location
I
application.
Starlina?
was just gonna ask that. Like, it's sort of like an audit trail that is that what you mean
Yeah,
by
I
that?
pulled it up last meeting. I just want to make sure if you guys have played around in it since I brought it
I
up.
have not played around at all, like,
I would like to see it.
Again, raise your hand. Let's say again because I did pull it up. Okay, so it will be so you can let's see go through your app bar.
Yep.
Pull that up. Okay. So your app bar, everyone has access to it. I've logged in through each options. So you would go to customize, excuse me, and go to your buttons, and it's called Visit History Viewer. So once you have that on your app bar, you can include this on your app bar to use just to, I guess, have a trail of the patient, their treatment. So let's type in, let's see, this one has a good enough trail.
what domain
for
are
us
you in,
to see.
Starlene?
Yeah. Are you
you
are
share
you sharing
your-
your screen? right
Yeah,
now?
I
Oh
was-
my goodness, I'm not sharing my
Yeah.
screen.
Yeah.
Okay, have you guys can see my screen?
Yeah.
Okay, so you would go in your app bar here. You would click on how to customize your app bar.
Yeah.
Go to your buttons in here and visit view history. Visit history viewer.
Yeah.
You can add that to your app bar. Click OK. Then you can launch it from there. You got one pulled up. So you would type in the patient. I'm going to use the one I have here. See if this has any information for us. So this application kind of helps trail the patient. As you can see, this patient looks like it was in a regular bed and then sent to the mental health at some point. And it has the transaction times.
And would all the HIM roles have access to this, Starlina?
Yes, I logged in with both manager and tech, and those two have access.
Okay, manager and tech, and clerk would have it too, right?
I didn't try clerk, but I can try. Trying to see one that went from the ER to the floor, possibly, just to give an idea of what that looks like. Oops. Yeah, Here's one. Yep. So you can see the emergency that came through the emergency and had to go to day surgery for whatever reason. And you have your times here.
Yeah.
On when they landed. So this gives you a better detailed description of the trail of the patient in the course of their treatment. As far as times are concerned, that you will not see front facing here in Power Chart because these times are entered, through Catman and, applications in the back end, but that gives you a front face view. So I just wanted to point that out to kind of
Can you
help you
remind me
guys.
again what that one's called?
Yeah.
What did you call it?
It's right here.
Yeah, no, okay. Oh, visit history viewer. Sorry, it was just the name I was missing.
Yep, no problem. And also, let me share my screen. To it first. Right, so you guys are aware of the SharePoint or Teams, I'm sorry, the Teams, not SharePoint, where we have for HIM, we have files and here we have job aids in here for you guys to access, one of which is the history view. I think I put it in coding. Yeah, I put that job aid right here for you guys to have access to. So I just wanted to bring that up again to make sure that you guys know that there are job aids out here for you guys to access and implement in your end user training. So I've added, Amanda has started it, and I've added quite a few as well. Quite a few. So especially with ROI, I think I'll put a detailed job aid in there for request management for you guys to view. This gives a lot of detail and breakdown of that application because I feel that, the more understanding you have with clicking on these things, the better the process and working through it. So it gives a pretty detailed overview of that application. If you guys wanted to give to your user or if me wants more information on it. Any questions on the files and stuff and where to access? Do you guys have access to it? Make sure you guys have access to it. Let me know. We can get you added. Any more questions on Power Chart? And yeah, Jason, I don't know if you were here for the visit history viewer that I went through.
No, I wasn't, but yeah, don't feel you have to go back and redo it all.
It's okay. It's all recorded, so it's okay.
Oh, excellent. Fantastic. Thanks.
So I have a question.
Yes.
So is there a possibility to view what kind of OR information is there in Power Chart? For example, dates and times. Where do you record that? What does your anesthetic record look like if we're in Power Chart?
Let's see. I think I have anesthesia record I can probably pull up. Right. Patient down. And Amanda sent the link to the Teams if you don't have it. Typing in the patient is a long name.
Darlene, are you supposed to be sharing your screen? Or no?
Yeah.
Okay, because it's, okay, there we go.
Thank you.
There we go.
Thank you. It's what the OR enters. A lot of patients. Transport times. The interoperative record. I can, you guys want to look at it on your own, I'll place that patient in the chat. Let's see, PACU. Let me see if I can find possibly another patient that may have more. Of a robust record.
This is the piece that I'm really struggling with
Okay.
is the lack of actual documentation in our test patients. Really and
Yeah.
truly, I've not been able to train my
No
coders how to
kidding.
code.
No kidding. I've not been able to see the release of information when I want to release a chart.
We've
no
we've
information
done
in
a
it.
few. We've taken the time and run through a few but even at that, we've only got one, right? I just really struggling to know how my coders are going to be able to pick up information and how much turnaround time I need to add to their roles.
Yeah, it's going to be substantial, I think, Tanya. Like, I think when we were doing training with the coders, like it was better. Training with the coders was better than the trainers with my clerks because two of my clerks are, they're sort of new to the role. They're not that they're not computer savvy, but they're not just as quick to click around and see what they can find, where the coders were, we were clicking everywhere and we were like, oh, I found this. Oh, I found that, whatever but if they have to do that for each and every chart, it's going to be substantial.
And the other piece of it too, and I think I've mentioned this to you guys before, but your ALC diagnoses. Nowhere in the documentation are you going to get that put anywhere for your, the 20 diagnoses that we need to put in for when they get the service transfer, right? The doctors aren't going to do it. I've added it to my workflow, my discharge planner. I've got her putting it in the ALC form in a special spot because it's currently on our form, but it was never built in the system. So I don't know where you guys are going to find that information if you don't do that workaround. And that's the other piece that I have, right? Like as we get closer to this, does stuff like that, when we find there's missing documentation, does that come up through the command center to be put in as a fix, or how are we handling stuff like that?
You said that there's things that are missing. Are you saying that documents that are missing that the clinicians failed to report or something that they've done that you can't see?
No, they failed to build the ability. Someone has to do the diagnosis for ALC, right? CIHI. It's not in there. I've come up with a workaround. My discharge planner, who is my ALC delegate, is going to enter that for me, and she can do that. But nowhere has it been built in here to capture that. The clinicians can't capture it properly. SNOMED does not capture all those codes.
Has this
So
been documented on the clinical side?
I'm going to have them document on ALC. If you go to, you're not in as nursing. Are you able to do everything?
Oh, no, not under this one. I can
Okay.
go into center support if I need to.
It's under, so if you go in, if they document under ad hoc forms, they'll have an ALC form.
Is it under nursing clinician or, I mean, nursing documents?
Nursing or allied health professional, because the discharge planner will do it.
Do you know what folder?
Nope, I've never looked at it at this end. I've only ever looked at it at where it's created.
So if this is something that can be entered, would this be considered a workflow that needs to be implemented on their side?
I read, anyways, in my WTIS meeting for ALC yesterday, I told them that they needed to reach out to health records to find out how that information is going to be documented. When they did ALC WTIS, they only looked at the WTIS documentation. No one considered what was needed for CIHI. So I have come up with a workaround on my own that I'm going to implement at our organization. I don't know what everybody else is going to do. I'm happy to share it. But I don't know, you may want to talk to however you get that information now, you need to find out how they're going to get that information to you in the future.
I think that would be a start for everyone to reach out to see how that will be documented. And second, if there is somewhere that can be documented, possibly if
Oh,
that.
it's not absolutely not appropriate to document where I'm documenting it, but because it's under copay. But that's the only
I
spot I
thought
can
you said
find
that
free
there is a
text.
spot for it. There's a spot for it, but they're not going to do it.
It's not an
Because
appropriate
if that's the
spot for
case,
it.
then that should be I guess incorporated in their workflow. So, so that's what I was getting at.
Oh, I agree. I've been chasing this for 6 months and I think everybody thinks I'm crazy. So just heads up. Heads up, health records. You may be looking for that diagnosis.
But yeah, I would start now on seeing what that would look like and get your feedback from your clinicians. Uh,
Tanya,
um, di-
sorry, can you share that ALC workflow with me at least? Because I'll need to go hunting.
Yeah, actually, can you log in, Starlina, as a nurse?
as a
Are you
nurse,
able to, just so you can document, and then we can show everybody what I came up with?
I'm in center support right now. Which has access, or do you need me? Okay,
I need you to be a nurse to be able to
Okay.
document ALC.
I'll do that.
Please and thank you.
No problem. This one fine?
Yep. So you need to grab a patient, any inpatient. Okay, so if you can go under, oops, ad hoc. And then you're going to see about 5 down, ALC documentation, click on that. And then chart. So if you see along the side where it says WTIS, additional information and chronic copay. So if you type on additional information, click on additional information, I don't think it had anything in there I could use. Do you see
Where?
along the left-hand side
Left-hand side.
at the very top,
Oh,
over a
I
little
just
bit
got
more? Yep,
tabs.
right there. Right? So there is no free text there. There was nothing I could do. So if you click down to chronic copayment, under notes, what I'm going to have my discharge coordinator do is type in there. She knows the Z codes, like she has a list. So she'll type in like Z59.0. Or what's the other waiting? Z75.3. So she'll put those in there for us. And then we know what the diagnosis should have been for that service transfer.
So this form may not be accessible for an HIM role. Are you guys doing this under the nursing role or the HIM?
I don't know, that this is our question, right? Like this is the only workaround I could find after chasing this. I started chasing this in July. I just got my emails now, actually even before July.
Staff needs to do, then it may be a workflow that
So HIM should see the entire chart. If HIM is not seeing the entire chart, we have a major issue.
well, this form, this form will generate under a power form, will it?
So whatever information is put in here, Starlina, does it come out in the record as like a report kind of a thing? Like we were looking at, what did we just look at? Like the main OR intra-op record, how it showed everything? Like whatever they enter, would it get filed as a report somewhere?
Let's try to create
Yeah.
one and see where it goes, because it
Just do
should be a
today.
power form if it's created by the nurse. And I'm just clicking, I have no clue.
And you'll want no. Just click no.
Here, you would say you would have your I-10.
Yeah, so let's do Z75.3, unavailability and inaccessibility of healthcare facilities.
I'm going to
Just
type
says,
all that?
that's good.
Okay. All right, so let's. Oh, let's go to my HIM manager. Pull up that patient. Right. So right here.
Here we go.
Okay.
I would suggest if this is a nursing clinical workflow, this possibility of adding would need to be implemented.
Yeah, so this is a workaround, but this needs to be fixed in optimization. Really, I don't know why there can't be another tab along the side where we put in, we have those, what, there's 1, 2, 3, 4, 5, 6, I think there's 21 codes that we're allowed to use. We're only allowed to use 21 codes. Where we just create that form, they pick it and Bob's your uncle, right?
So, I mean, be mindful on where this is under.
Yep, that's what I'm saying. It's not appropriate to be there, but it's the only
Yeah, so,
workaround
you
that we
know,
have.
just be mindful of that. If there is maybe a note that the nursing can create,
It's
probably
not
would
nursing.
be
Nurse,
more sufficient, then that would be the route you would take. I guess, integrity wise, you want to make sure that the record makes sense. That's all I
and
have
right
to
now
say
the
about
record
it.
does not make sense, and we're going live with this, right? So we have to have a workaround, and there is no other spot that I have seen in any of the documentation, and neither has my trained, discharge planner. This has been missed, and it's been known about since July, and we've not fixed it. I have chain after chain after chain after email trying to get this fixed.
Tanya,
So
can you send me send me the emails that you have just so I can read and get a better understanding,
yeah,
and then summarize it for me so that I can put it in for optimization and put a
okay,
ticket in. Thank you.
okay.
Right.
And we didn't, so if we have a question like that, how do we escalate that during go live, right?
You're thinking I don't think you would escalate it during go live, because go live will be more like, this isn't working, we need to fix it. Whereas this seems more like we need to have discussions about how we're going to figure this out, workflow, new build. So I'm thinking it's better that we put it in, we flag it, and then we make sure that it's on the optimization list so that we can cover it in our group meetings and get it resolved.
So send an email to yourself.
Yep.
Put optimization need.
Yep.
Okay. Something like that.
Yeah, and just because I'm not familiar with this, so if you can make it understandable for me so that I know what I'm asking for, that would be helpful. And then, yeah, we can get it in.
So, okay.
Then it's on the list.
Have any navigation questions within Power Chart?
And just to confirm, we do have access to all the documentation, correct? That comment kind of made me a bit nervous.
That's a kind of a late in the game now, right?
No, you should definitely have access.
Yeah, what documents do you feel that we will not have access to?
Well, that's what I'm asking, because you when we were looking through that, you're like, oh, well, you have access to see that. And I'm like, wait a second, I never even considered that as an option for HIMSS not to have access to see the entire chart.
Oh, no, we do. We do have access.
Okay.
To that.
You just made me real
I'm
nervous.
sorry. No, we have access. Okay, any other questions? So, I think there's a meeting at 1 for a downtown viewer. Think everyone is included in that, so that will be a good meeting to join if you're not able to have a representative at least. They'll be going over that application. And also a question about scanning documents for at least 4 appointments that start on the 6th. That's in discussion right now, on, getting, I guess, the to go into Prod and start those documents as part of clinical cutover. If you guys have any documents to start scanning in for those encounters. Any other questions? Well, I have another meeting for, workflows and discussion next Tuesday. So between now and then, as you guys go through your training, write down your questions, and we'll work through them in our next meeting.
You have questions, not in power chart though, but distribution, is that another topic that we can just visit? Sorry.
I mean,
Amanda's here.
Is it a part of it? If it's a part of, workflows and all that stuff, sure. This is where we ask.
The question regarding lab report distribution from my end. Is there such a thing happening? I think there
Yes.
is. Okay.
Yep.
And that's basically using the same platform, right? That if like reports distribution, radiology distribution, same way labs will be distributed.
Yeah, it's just a different template.
Okay.
So distribution's on fire right now. Everybody's asking questions. So I just created a distribution Q&A, and I just tried to put in the chat, but it does not seem to want to do that. So I'm going to send it to this group, and hopefully it simplifies what is a very complicated process.
Can you please, it's Lizette and I'm subbing in for Samantha. Can you please add me to that email that you're going to send out just so I can put it in the minutes?
Yeah, for sure.
Thank you.
You're welcome.
Would I fan the fire if I send that on to my doctors?
I sent it out to Dr. Sid this morning to respond to all of their questions. So they should be getting a copy. And it's also going in the Lumio library because Gina was asking for it because she's been getting questions as well. So I fanned it out to a whole bunch of people today.
Yeah, no, both of our physician champions are not happy.
Is it Dr. Glatt? Is that your physician? Yeah, so he did get it. Yeah, he got it.
He's got it? Okay.
Yeah.
Is it going to make him happy?
Yeah, I think so. I think it's just confusing, right? And if you don't have all the information, you assume the worst. So just trying to give everybody all the pieces so that it makes sense. Okay. Sorry, Regina, I didn't mean to cut you off though if you had other questions.
No. That's a good one. The other thing for distribution was the ER report distribution. That's also part of this?
Yeah.
Okay. Just
Yeah,
want to
so there's-
confirm.
Yeah, you'll see on the sheet there's 4 different ones. So there's the medical records,
Yep.
which includes everything clinical documentation.
Okay.
There's a lab one, an anatomic pathology, and a diagnostic imaging one. And
Okay.
so all 4 of those will run.
And ER report falls into clinical documentation, right?
Right, exactly.
Okay. So in that, like, how would that work though, sorry, Amanda, like, so a family doc will get an ER report? Is that the logic unless it's specified not somehow?
Yeah, exactly. So during registration, there's a field where they ask the patient their primary care physician. And then at that point, when it's entered in, that's sort of the field that triggers it. So as long as there's an entry in that field, that physician will get a copy. And then alternatively, there is also an option to say that they don't want it to go to their family physician, and then it leaves the field blank. So, you know, like if they say they don't want it to go,
Yep.
then there's also that choice. So, yeah, but that's how it, and then if the physician wants to include anybody else, they put that in the CC provider and then it'll go to them as well. But if they already include, let's say they CC the family physician, not realizing that the family physician was already listed,
Yeah.
the system will, you know, double out the duplicate and only send it once.
Oh, that's lovely.
Yeah.
We won't get calls saying, why did you send 2 reports
No,
for the same
so
thing?
annoying, eh?
I know.
We got a bitchy.
I
We got a
Just be
bitchy
happy you
email.
got it at all.
sometimes
Yeah,
I
we-
think they count each piece of paper that gets used in their
They do.
office, right?
I literally got this crabby fax back to us saying, like, we've noticed an increase in this and that. Like, we get this through HRM, receiving it in paper, and blah, blah, blah. I'm kind of like, better you got it twice than not at all, because then the opposite is you call to
Right.
complain, I didn't get this. Like, anyway. I did have a question about the documentation piece, though, as we're talking. So in the ER, patient family doctor is not in the system.
Yeah.
So we have to, and I don't know last time I had heard, I don't know that it was decided, maybe it is now. Who has the ability to add providers into that system? Is it locally or is it regionally?
That's regional.
Okay, so
So
it's 2 a.m. Saturday night. Patient presents, doctor's not in the system.
yeah,
Nobody's
that's
going to
fine.
be
So
here.
they just add that doctor in. Now I'm just wondering, actually, good question. If they are not even selectable, can they freeform it? Let's have
I
a
hope
little
not.
see. Yeah, I don't know.
I
That's
don't
a
know,
good
that gets
question.
deja vu whenever people start guessing at spelling and all of that kind of stuff.
Like it could, let's check, because it might be like a workflow issue where they need to notify that they've had a new physician and they need to send in that request to us.
Right, and then my next question is, how quickly is that actioned on the, and I know you don't necessarily know the answer to that, Amanda, but that's the problem, right? Because if that's something that takes a week to happen, or even days to happen, things, so this is why I asked the question, because if it's not entered at the time and then we enter it in after the fact, does it push out that, like, is there a way that will then push out that emerge chart to that doctor, or do they just not get it because they weren't identified at the time that everything was signed off? And not just the
Right.
emerge piece of it, anything that would go out, you know, patient had a CT scan while they're in that emergency, whatever, like what happens after the fact?
So the reports are cumulative. So as soon as a result is verified, it gets put in the queue. We get to decide how many times a day we send those reports out. So it can be as frequent as every 15 minutes, or it can be as staggered as once a day. But so like, let's say that they came in, it wasn't there, they put a request into Lumio. We work 8 to 4, so we come in. I think that there's like service level agreements in terms of how long things can take. And I think the longest is like 24 to 48 hours. But you know, if they say like this needs to go out, it's an urgent result, you know, we get it in right away as soon as we come in the morning. All it takes to do is just put in a fax station and then have it sent off. Now I'm just trying to think though, I want to see what they can do, because we have 13,000 providers in the system. So the likelihood that they're not in there is going to be pretty low.
I think that's a really big assumption.
That's a, like,
I
I don't
think
know
it-
how many doctors there are in Canada, but I thought 13,000 was a lot, so.
I know that at one point, like several years ago now, like I'll say like probably just around the start of COVID, maybe just before, we had the IT had a student and they basically went through the College of Physicians and Surgeons website and were entering in doctors, and we regularly have to add doctors. It was entered in at the time, so obviously it's not kept up to date every single year, and there's new grads that start a practice and whatever, but so that's why I say, unless somebody's updating it on a very regular basis, it's a big assumption to think that it's not gonna happen regularly.
Yeah, so it is going to be updated on a regular basis, of course, but yeah, I think the idea is if it's not there when you need it, what do we do? So let's see, what are we gonna do?
And then like, so I know you said it gets queued, so if it happens, say Tuesday morning, it's a long weekend, and Tuesday morning, the Lumio team comes in, they add in that doctor that has been requested to be added.
Yeah.
So they add them in. There'll have to be some sort of communication back to somebody to say that doctor's now in there so that I can go, or do they just enter like
Yeah,
how do I then attach that doctor to that patient's emerge chart? And once I attach it, if it's already gone, if like the job queue has already been queued to go, but there wasn't a family doctor identified, so it didn't go anywhere. Now, 3 days later, I come in, I add Dr. Smith in because now that doctor's there that I can use. By me adding that in, is that enough to trigger those messages to go back out?
yeah, good question. No idea.
Okay, perfect.
I can find out. I'm just gonna share my screen. Okay. So let's just do a fake registration here and see. Okay. So this might be tough to try and find a physician that isn't in the system. Let's make up one. Pretend I'm a physician. Because I'm definitely not in there. Oh, I am in there. Okay. How about do my son? He's definitely not in there. Great. Okay. So I don't see any option for saying like, okay, put it in anyways. Let's see if I can free. Okay. So I can, but it's saying there's no matches.
But it's still yellow, so you haven't really, right?
Right. Like it probably wouldn't let me move past it.
Or it probably wouldn't save. Like it might appear to be there, but maybe it
Can we
goes
try
away.
saving it? Can we try saving it?
Yeah. Let me just see what it says. Yeah, it is highlighting it as no go.
That would be a problem.
Yeah, so you can't. So there's gonna have to be some kind of registration workflow that if the PCP is not in there, they need to send a ticket to get it added. And then it'll be a workflow between Lumio and registration in that ticket to communicate back that the system, or sorry, that the physician is in there, and then they can add it. But I think it's a trifecta because then I need to follow up with registration and see like if they can go back in and add it, if that fixes the distribution, or if we have to like, monitor it and put it on some list to do ad hoc or something like that. So
Yeah,
amazing question, Jody.
Yeah, I
Just
think
it
I
happens
remember
regularly.
walking
So
through this. I think I remember this question before, and I think Carrie, she had some input into it too. So yeah, definitely take this to follow up on the process.
So on that note, we need that workflow created before go live. just because otherwise things are gonna get lost, right?
Yeah, for sure.
Because we need to know who is doing what and what is our role on the other end to be able to facilitate that, right? Otherwise, the risk is the report's not going to the physicians that they're supposed to.
Yeah, so I'll follow up with Vinny to see what he says happens in that case. I'll follow up with Reg to see if we can make that update post, like once they go through this screen and they're done with it. And then what else? Vinny, Reg, and then myself, which is Limio. Okay, yeah. 3 pieces. Got it. Okay.
And I just added Melissa Wallace and Eric to the teams, so they have access to the job aids as
Perfect, thank
well.
you.
So, yep. So if anyone does not have access, just let me know.
I was just sending my coordinators the email with that to go and check and see if they can access it. So I think it probably flagged you then, right, Starlina, that these people don't have access.
Yeah, all I got is Melissa and Eric so far.
Which it was change management, was it? No, it was,
Sorry, no, the job aids for HIM.
yeah, in which, for the HIM folder?
Yeah,
I think I
Yeah,
came in
so-
after that.
it's under HIM, and you would click on your file, on files, and you'll see job aids. And Amanda, I think in the chat as well.
Yes.
Well, if there's not anything else,
One more,
like I said-
one more.
Oh
one
yeah,
more
sure, go
before I
ahead. I'm
let
sorry,
you
I'm sorry,
go.
go ahead, go ahead, go ahead. Go ahead.
I have questions and questions. That's why I'm just looking at them. I think we have talked about this, like patient's visit history report.
For
So
income
at
tax
some
time.
point, yeah, it's the tax season's coming right after. So, everybody's questioning this. So can you guys actually show us one of these days, or if you don't know yet where it is, where we will find that detailed report on all the visits of a patient? If a patient is looking for like all their visits, a list of them.
Okay. I put that down for what we can go over next
Yep.
week, because I
Yep.
don't have that access, and I would have to get with registration to see where that is. So we're
That would be great.
make
Thank you.
note that we need to add this to include in our next week's agenda.
Thank you.
What's your next question?
I think with that being said, maybe in the next week, can we look at the Discern portal and all the reports?
Yep.
Just to see. I think that would be a good idea to review.
I will look into that as
And I-
well. We can go over, because I want to make sure I have access to all of them. Right now, reporting is saying that they are holding them until go live, but I'll look into that.
They shouldn't hold them because
Yeah, like specifically reported, like just because on Go Live, like I'm worried about like doing validation. So need to know, I want a report that shows me every single person that was been registered on that particular day so that I can cross-reference that what got registered in Cerner came over to WinRex. So for like, particularly on that like Go Live weekend, we're gonna need a merge registration, like a merge register, admission and discharge, with services, or, that we can see that information is flowing where it is. And then right
Absolutely.
thereafter on Monday, I'm gonna need that for outpatient and day, like those like registers for each day are going to be really important for all the HIM people to do validation into WinRex, because we're already concerned about the interfaces as it is, that we at least need to know that our patients are getting over there.
Absolutely, and that's a part of our post go live.
Because we just have not seen a report
checklist.
that looks like that yet. So
Now, I don't know if you guys remember, I sent out instructions on how to run that report.
Yeah,
if you
I was gonna say, are you talking about the admin discharge? Because we did go over that.
Yeah, we did. Maybe if you don't have a folder in your inbox that has my name on it, start one and then just pull all my crap that I send you in there. And then, you know, if you ever need something, it might be in there. I don't know, but
Amanda,
Yeah.
is that in the job aid folder? If
no,
not-
because I think let me see what I sent out, and then if there is a document that's attached to it, I can throw it in there.
Oh, okay.
That would be great if it can be included in that job aid so that,
Let me see.
thank you. How long ago would you have sent that? Amanda?
Oh gosh, I think it was when we first started doing our change management meetings. So what was that? Summertime?
No, I think it was right after when we started doing our cutover readiness assessment with Janine, because that was the report. That's the report that needs to be ran after go live for those checks and balances. And I think that next change meeting. Yeah.
So
You're right.
what
So
we're
next change meeting, we went over that report. Just gotta see exactly
it-
which meeting that was.
Is it specific to like one single patient?
No, it's everything.
Yeah.
No. So that's what we are asking. We want one patient comes to you and says, give me all the visits.
Oh, no, not that report.
That's different.
We're talking about admin discharge
validation
report.
Okay. That's why I was like, oh, I missed it. Sorry. Because
No, not
I
that
think
report.
I
We're talking about
was
the
reading.
admin discharge
Okay.
report.
Okay. No, admit discharge I do see in the Discern portal. But
Yeah, it is in there. Yeah.
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 I've seen it. I've seen the title in there, but I've not seen it
Yeah.
run.
Okay. Yeah.
yeah,
It
so
can- it
maybe
can be
that's why I
ran.
think it would be a good idea to visit some of those. Plus, if you guys can find out about a specific patient who's looking for all their visit history, because come January,
Yeah, I got that written down to
goes
follow up
through
with
out of the gate.
registration.
perfect.
All right.
Thank you, ladies.
Yeah.
Thanks.
Until next time. Have a
Yes,
good
until
week.
next time. Thanks, you guys as well. Bye.
Bye.
Bye.